So in the last section of in encephalitis diagnosis, now we will talk about the differential diagnosis. And the differential diagnosis, we will discuss the autoimmune causes of encephalitis, also the encephalitis caused by the raccoon pinworm, flavivirus and West Nile virus encephalitis, and then rabies encephalitis. Differential diagnosis mimics of focal viral encephalitis. Examples which are in the differential diagnosis that mimics the viral encephalitis, especially the focal type of viral encephalitis, is the mycobacteria and fungal infections, Rickettsia and Listeria infections, mycoplasma, and some other bacteria like Bartonella. So it's important that all these different organisms, microorganisms that can cause encephalitis, we need to differentiate them from the viral encephalitis, which is most common cause of the encephalitis. For proper treatment and management, differential diagnosis is important, so we should start the proper management. So mycobacteria like Mycobacterium tuberculosis, and then we have some fungi that can cause the infection, Rickettsia, Listeria monocytogenes, Mycoplasma, and then Bartonella species. Autoimmune causes of encephalitis. So what are some autoimmune causes of encephalitis that should be differentiated from the viral encephalitis? These are associated with antibodies against NMDA receptor, voltage-gated potassium channels, AMPA, gamma aminobutyric acid, GABA receptor, and GAD65. So autoimmune causes of encephalitis, usually we differentiate them from the viral encephalitis by some specific features since it's autoimmune. Autoimmune is the disorder or conditions which are associated with antibody formation. They are autoimmune. They affect the person's own immune system and cause the damage or disease. So this is characterized by finding the antibodies, and antibodies are present against the NMDA receptor, voltage-gated potassium channels, AMPA, gamma aminobutyric acid receptor, GAD65. So this is the autoimmune causes of encephalitis. Causes of encephalitis that mimic caused by the viral. So as I mentioned, these are all the causes of autoimmune encephalitis. We find the antibodies against different factors, different receptors in the body, and all these mimic the viral encephalitis. Infection by amoeba, Naegleria fowleri, common infection, amoebic infection. How we can differentiate cause acute meningoencephalitis and immunocompetent children. So this type of amoebic encephalitis, usually it affects the children which are immunocompetent. They are not immunocompromised. They have intact immunity. They are affected by amoeba infection. Then infection by acanth amoeba and Balamuthia. So how we can differentiate this encephalitis? They produce granulomatous amoebic meningoencephalitis, subacute or chronic form. So again, these are some other causes of encephalitis, and they have some specific presenting features. They can cause meningoencephalitis, one in immunocompetent children and other shows the granulomatous amoebic meningoencephalitis. Next is the raccoon pinworm encephalitis. This encephalitis is caused by the microorganism, by the Basilocercoris priosionis. So, Basilocercoris priosionis, that's the causative organism of the encephalitis by raccoon pinworm. History of raccoon exposure is present because it's the raccoon pinworm encephalitis. So exposure to the raccoon is in the history is present. So always ask about the exposure to the raccoon pinworm. Playing in and eating dirt. Lot of children, they have the habit of playing and they sometimes eat the dirt also. So that causes the raccoon pinworm encephalitis, and it is caused by Basilocercoris priosionis. Contaminated with raccoon feces. Now the dirt that is ingested, usually it is infested by the raccoon feces that cause the disease. Most patients are children because the children are usually the one who eat the dirt and they play with the dirt also. Many have associated eosinophilia. The increased level of eosinophil is present in this infection also. So some important characteristic features: if the child has a history of playing in the dirt and eating the dirt, usually associated with encephalitis in the history like this, the first the thing that comes to the mind that it is the raccoon pinworm encephalitis, again caused by Basilocercoris priosionis. Next, herpes simplex virus encephalitis. Distinguish herpes simplex virus from other viruses. Therapy for herpes simplex virus, the herpes simplex virus is treated by specific antiviral therapy. The efficacy is enhanced in course of infection. Other viruses, usually the therapy is supportive. As I mentioned previously in one of the section also, that the therapy for viral infection is mainly supportive, and usually it takes the time to recover. Viral therapy is not very effective antiviral therapy against different viruses. But herpes simplex virus usually is antiviral therapy like acyclovir is effective for herpes simplex virus infection. So therapy is mainly supportive. Differential diagnosis of herpes simplex virus encephalitis. We have involvement of inferomedial frontotemporal brain region, prominent olfactory or gustatory hallucination, anosmia, lack of smell, unusual or bizarre behavior or personality alteration, and memory disturbance. These are some features of differentiating point of herpes simplex virus In encephalitis, there is anosmia, olfactory or gustatory hallucinations are present. There is disturbance of the memory. Indicate of herpes simplex encephalitis. All these features, if they are present, it's a clear indication that it might be herpes simplex virus encephalitis. There is disturbance of the memory, and usually it involves the inferomedial frontotemporal brain region. Infections by other viruses, there is progressive encephalitis, prominent brainstem signs and symptoms, neuroimaging abnormalities, infections by Listeria monocytogenes, flavivirus, and rabies virus. So all these are some other differentiating features of the infection caused by the Listeria, flavivirus, rabies virus. There is progressive encephalitis. Mainly it affects the brainstem region, and there are neuroimaging abnormalities present on the imaging techniques. Flavivirus and West Nile virus infections. Usually flavivirus infection, deep gray matter structure involvement, including basal ganglia and thalamus, prominent movement disorder, Parkinsonism features, which are movement disorder like clasp knife type of reflex, and the walking is disturbed. So all these features are present if the infection is caused by the flavivirus. West Nile virus infection, poliomyelitis like flaccid paralysis, lower motor neuron type weakness, reduced or absent reflexes, relatively preserved sensation. So motor neuron type of weakness is present, but sensations are preserved. So very clearly we found some differentiating points of different infections or different encephalitis caused by different viruses. There are some specific features that gives the clue that it might be due to this virus or this bacteria. Differential diagnosis, again, epidemiological factors also provide a clue about the causative factor. Attention to season of the year is also effective. Geographic location and travel history, exposure to animal bite or scratches, and exposure to rodents and tick bite can cause the Lyme disease is caused by the tick bite, Borrelia burgdorferi. So all these are different clues that can give the idea if the patient traveled to certain region of the world that has some common diseases present there, so it can be affected by that. So all these can give the clue to the differential diagnosis of the cause. Clinical presentation of encephalitic rabies featured. There is fever, fluctuating consciousness, patient is alert sometime, and there is altered consciousness, autonomic hyperactivity, phobic spasm of larynx, pharynx, spasm of neck muscle, diaphragm, hydrophobia or aerophobia, paralytic rabies, acute ascending paralysis, and neurologic deficit, seizures, hallucination. So all these are the features associated with the encephalitis caused by the rabies virus. Also, the examinations or tests performed in case of the rabies encephalitis, there is cerebrospinal fluid, lymphocytes are increased T2 signal abnormality areas in the brain, hippocampus, also in hypothalamus, finding rabies virus antigen in the brain and in neural innervation of hair follicles. Diagnosis by PCR amplification of viral nucleic acid from cerebrospinal fluid and from saliva or tears. Serology is show negative in serum and cerebrospinal fluid in the first week. Limits in acute diagnostic utility. So serology is not very effective. No specific therapy, cases invariably fatal depending on the severity, and devastating neurological sequel is present in the rabies encephalitis. That concludes our lecture in which we talked in detail about different diagnostic tests for the diagnosis of encephalitis. Thank you for watching sqadia.com.